She's an infection prevention practitioner at Lima Memorial Health System. And today she's going to talk about the differences between colds, influenza, and RSV. So, Heather, what exactly are the key differences between these illnesses?
Colds, influenza, or the flu, and RSV are caused by different respiratory viruses. Colds are typically caused by rhinovirus, parainfluenza, or seasonal coronaviruses, not to be confused with the virus that causes COVID-19. The flu is caused by influenza viruses only, and then RSV is caused by respiratory syncytial virus, which is a common virus that affects the respiratory tract.
All right. And how do symptoms of these illnesses manifest?
Cold symptoms are generally very mild and may include a sore throat, runny or stuffy nose, coughing, sneezing, and sometimes a mild fever. Flu symptoms are often more severe and have a sudden onset. Symptoms may include fever, chills, muscle aches, headaches, cough, sore throat, runny or stuffy nose, fatigue, and even sometimes gastrointestinal symptoms like vomiting and diarrhea. RSV symptoms can range from mild cold-like symptoms to severe respiratory diseases, especially in infants and older adults. Common symptoms also include coughing, wheezing, difficulty breathing, fever, runny nose, and decreased appetite.
All right. And are there any complications associated with these illnesses that individuals maybe should be aware of?
Yes. Colds themselves generally do not cause any serious health problems. The flu can cause mild complications such as a sinus or an ear infection, or even more serious complications like pneumonia, inflammation in your heart, brain, or muscle tissue, or an overwhelming infection that we call sepsis, which can actually lead to multi-organ failure. RSV can also cause more severe infections such as pneumonia and bronchiolitis, which is an inflammation in the small airways in our lungs. Healthy adults and infants infected with RSV generally do not need to be hospitalized, but some people, especially elderly adults and infants under the age of 6 months, sometimes have to be hospitalized because they're having trouble breathing or they become dehydrated.
All right. So what preventative measures can we take to prevent spreading and maybe even catching these illnesses?
Yeah, we can all prevent the spread of a lot of illnesses by practicing frequent hand washing, avoiding contact with people that we know are sick if we're able to, and covering our coughs and sneezes. Seasonally, if you get your flu vaccine, that will help reduce your risk of getting the flu. And then RSV can be prevented in certain age groups. Folks over 60 years old can get the new RSV vaccine that's available at their local pharmacy. Pregnant females can talk to their provider about getting an RSV vaccine during their last trimester to help protect the baby from RSV once it's born. And then babies that are also born during the RSV season can sometimes qualify to get antibodies for protection.
All right. And then let's say somebody might want to make a same-day appointment at Lima Memorial to address any concerns for their symptoms. Can they do that?
Absolutely. They can call the number on the screen and we will get them set up with one of our providers and help them get back on the path to feeling better.
All right. Well, Heather Jackson, I want to thank you so much for joining us from Lima Memorial.
Sure. Thanks for having me.
My pleasure. Well, don't go away because we have more when we return.